Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to discuss moisture balance and why it is so important. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel grow. So let's get started. So what is a moist wound environment? So a moist wound environment is when a wound is not too wet and not too dry. So there are three types of different wound healing environments. One is dry, where the dressing absorbs, but it doesn't keep any moisture. Moist, where the dressing absorbs some and it keeps some moisture. So it'll release some moisture and it keeps some moisture. Now, wet is where you seal the wound with a membrane and it keeps all the fluid within that membrane. So why do moist wounds heal faster? So really they heal faster because epithelial cells migrate faster in a moist environment. So in the final stages of wound healing, epithelial cells migrate across the surface of the wound to close it. Okay, so these cells need moisture to move across the surface of a wound. If the wound environment is dry, the cells will have to find moisture deep in the wound bed. So then they have a harder time healing the wound. So it does slow down the healing process. So studies have shown that a moist wound heals 50% faster than a dry wound. Now, on the other hand, if a wound is exposed to air, this creates a dry environment that actually promotes cell death, not healing. So that's when a scab will form. Now, wound exudate does play a vital role in healing process, okay? So the fluids provide nutrients, protein, glucose, white blood cells that are necessary for wounds to heal. So that's why it's so important to keep the wound just in a nice moist environment, not letting it scab over. Now, if you do get a scab, it is important that we just leave it because we'll cause more damage removing it, but we do want to keep that moist environment. So how to create a moist healing environment. So one of the most important ways to create a moist healing environment is to choose the right type of wound dressing. So you're going to start by assessing the level of exudate. Now this assessment will give you the information you need to choose the right dressing. And it also determines how often you'll have to change it. So in general, you need to look for a dressing that removes excess exudate from the wound bed. It protects the wound edges and peri-wound skin from maceration, maintains a moist healing environment. It helps your patient feel confident and secure. And it's easy for the patient to remove and care for. So when using the moist wound healing method, removing the dressing is less painful and traumatic to the wound, which also speeds up healing. And you also don't have to change the dressing as often, and it improves healing time. So the less that you're changing a dressing is the better, because every time you do a dressing change on a wound, it takes about 4 to 8 hours to get back up to healing temperatures. So if you don't have to do it every day and can go every 2 days or every 3 days for a wound change, that's very important, because then you get a longer span of healing time and you're not pausing that healing time to get back up to healing temperatures. So there are times where we should not use moist wound healing, okay? Because it is not suitable for all chronic wounds. So for example, you should really be careful when using moist dressings on patients with gangrene. So this is like eschar covered diabetic foot ulcers. This is because dry gangrene can progress to wet gangrene. So when moisture gathers under a dressing, this can cause the stable dry eschar to become unstable. So you should be very careful if you're using moist dressings on these patients. Also, fungating wounds. So we really got to be careful with these because we really want to keep them stable, and the scabs or eschar that's covering these can stabilize the wound, preventing infection. So that's all I have for this video. I hope you did find it helpful and it did help you understand moisture balance in a wound and when we should not be using it also. So that's all I have for this video, and I will catch you in my next one, guys. See ya.